Hello, and welcome to today's podcast. Today, we're going to mix things up a little bit, and I am going to interview Dr. Mark.
We're going to initiate the interview like that, but I also think it needs to be a dialogue
Well, certainly.
because there are topics of today's podcast that it's not just a male perspective, it's also a female perspective on the situation, actually. So,
Okay.
but I feel like, we talked about these topics on our own. We've had conversations with patients that related to these type of topics that we're going to discuss today. And it's one of those things that it's certainly, hopefully we can shed a little bit of light, but we can also give people a little bit of hope, about what they need to do for their care. And specifically, we're talking about the female population, essentially. So, but I'll let you kind of go ahead and initiate this. I may want to just have the little initial disclaimer that I will try to keep this non-political, and I'm not going to belittle or bash or talk down on, any specific companies or pharmaceuticals or insurance companies or, I don't want, the goal is not to do that. The goal is to talk to people and to meet them where they are. So,
Okay. Very good. All right. So, our first question, it's a big one. Why is working with women, especially those navigating menopause and perimenopause, something you're passionate about?
this is a topic that has been in the transforming aspect for years, but essentially it really kind of initiated when we first met and we first got together, and we had a shared passion of healthcare and medical missions, just a general zest for life. But what my passion is to try to shed light on, I don't necessarily want to call it, I guess you could just say that it's almost a disservice that has happened for the female population. And I am one of the people, I am a physician as well as a person that is not racist and is not sexist. I see it as it is, and I look for the balance. And truth is truth. And what I see is that, there is an idea that if a female comes into the office to be seen by myself, or just say another physician that's female too, but to not listen to what the person has to say and to not hear them where they're at and what they're needing is disappointing for me. And it's very common that I will see patients in my office and will hear their symptoms, see the meds they're on, and I will apologize to them. I am not their treating physician. I am not the one that saw them initially for these set of symptoms, but I understand that the symptoms they're having, no one was truly listening to what they actually say. And there are options that a person has to control or treat, but certainly to justify and give reason why a person is actually truly having those symptoms. So it's really hard for me to sum this up in just a few words, but I mean, I hope you can understand kind of where my passion is at, that, I feel like the female clientele, female patients have actually not gotten as much attention as what they should have. And I don't want to go into the political aspects of this. I don't want to do that. And I'm not going there, but there's just a lack of good, solid studies. We'll just leave it at that. A good lack of solid research studies to show what's truly going on and what benefits a female in their course, in their life course, going through perimenopause and into menopause.
Great answer.
I'm trying not to do that.
So, a lot of women might wonder how a male physician can truly get it when it comes to what they're going through. What do you want them to know about your perspective and your role in their care?
And that kind of alludes back to the first question answer, I think, to the fact that, you really, you have to listen to the patient. I don't care if they're man or woman, you got to listen to them. If you have an idea, that's fine, but but your ideas, your thoughts, your treatment plan is not necessarily going to be a cookie cutter for every person out there. And for the female patient, it takes me back. I just have to share this funny story that came to mind that, and I know I've seen it, and I'm sure other people have seen it too, where you have this man and woman talking. The woman has this excruciating headache. She feels awful. She's sitting down on a couch. She's talking to her male counterpart, and he's looking right at her, and he's going, "Honey, I know what's the matter with you. You need to take that nail out of your head." She has this nail sticking straight in her head. But she goes, "You need to just, I don't want you to fix me. I just want you to listen to me." And I think that is so, that hits me a lot. The fact that I just want to listen to the patient. I want to hear what they have to say, because majority, 90% of the time, you don't need a lot of labs, or you don't need even physical exams. You just need to listen to what the patient's saying. The patient will tell you what's wrong. And that's part of the biggest thing that I think our perspective is just literally listening, because we take such a long, extensive history, and we're not just going over labs, and we explain things, and we listen to really what is their biggest goal. And I think that's kind of really an important perspective that, you need to just sit down and understand where they're coming from.
So you got the second part of that question, but I'm going to ask the first part again. As a male, how do you get it when a female comes to you and they're explaining? Like,
how do I get it? That's a good question. Basically, I understand that the symptoms they're having is not because they're in quotes crazy, is that they truly have symptoms or outward expressions of systemic diseases, or lacks of deficiencies of hormones, vitamins, minerals, etc., things of that nature. In other words, things that are in balance and aren't optimized. And to say how I get it, I don't know, it's more intuition, I really think, than a lot of things too, so I guess that's long-winded answer for it.
yeah, that's all right.
For
That's good.
a short question.
One of the unique things about our clinic is that we are a doctor and nurse team. We're also husband and wife. How do you think that influences the way that we care for our patients, especially women?
Yeah. So I think it makes the women feel comfortable. There's a certain amount, obviously, when patients come in to see us, they may have, their blood pressure may be up, or, you've heard of them saying, "Well, I go to the doctor, my blood pressure's up, or my heart rate's up," so, but I feel like that with us being a man-woman team, we've got both sides of the fence covered, and we actually understand the details behind the importance of hearing it from both sides. And there are patients that, they want knowledge, they want answers, but they want somebody to hear them. And they know that, if you're in the room or am I in the room, whether it's a man or woman, they know that, okay, well, they're going to understand where I'm coming from. And I think that's the benefits we have, is that we've got the ability to hear that from both sides.
Yeah, I would agree.
So, but what do you think from your perspective as a woman and nurse coach? What do you think women are most looking for in a provider during the menopause, perimenopause time frame?
I think that what women really want is someone who will listen to what they have to say and hear them. I think it is all too often that you go to the doctor and you have put some kind of a complaint for your visit, and the provider comes in and they are focused on that complaint. And so they lose sight of the story that's coming out. So I think listening is really key.
Right. Yeah. There's a lot of benefit, and it's cognitive behavioral therapy at its finest, to be able to hear, understand, and direct on where they're at and the reasons why. Okay, you may go into, let's just say you got high blood pressure. You go in and, your doctor sees you and diagnoses the high blood pressure and starts you on medication. Okay, we'll see you in about 6 weeks. We'll recheck that blood pressure again. But why do I have this? And what can I do to correct this? So that's certainly something I think that, like you say, and it can be something as simple as, well, not everybody that comes in with mood changes or depression needs an antidepressant. So it's not something like that. So I think it's something we actually, I think, where we shine.
Yeah. We often look at labs together and walk through protocols. What does our team-based model give women, or how does our team-based model give women a different experience than a traditional doctor, do you think?
Well, I think we kind of alluded to that a little bit, is the fact that, we're not just based upon trying to treat a disease after it's present. We're looking for the root cause. And I think that with both of us, I think we bounce ideas off each other. And when we're asking questions, speaking to patients, that, it's nice to have two people to shoot those questions out there and to bring a different side to that, I feel like. So,
Yeah.
yeah.
So I think a lot of women come to us feeling dismissed or told that it's just part of getting older. What do you think is missing from the traditional approach to women's health?
What's missing? Well, there's a little term that we call confirmation bias, that essentially what I've been taught, and this is how it goes, what I've been taught or how I've been trained is how it is. And that's the way it is. And that's the way it'll always be. I feel like that is the old traditional way of training. It is obvious that the medical field is ever changing and is a process. We don't know everything. We think we know a lot, but I can tell you that half of everything we know now in 5 years is going to be changed. And so that's certainly a process of updating our circuit, if you will, our mental circuit, our decision-making circuit. And so I think that traditionally we've been taught to treat a disease process instead of treat the root cause, and try to control that and improve that so that we can avoid the chronic diseases, whether it be heart disease, type 2 diabetes, dementia, you name it, you throw it out there, and it's any of those chronic diseases. If we can identify those in advance, it's avoidable.
Yeah. So what I am hearing is that the confirmation bias kind of gets traditional providers sometimes in a pigeonholed into, this is the way,
Yeah.
this is this and this.
Yeah. And the classic finding that is, the old hormone WHO trial, study that was done back in early 2000s. So it hormone therapy has been disproved to truly, in most circumstances, not cause cancer. So it just does, it does not. And then the benefits of that are certainly very positive. So,
What do you want every woman who is listening to know about her options and about how we work together to support her?
yeah, that's the thing too, is that you kind of have to understand that you have to ask the questions why, and you can't just accept just it's part of aging or it's part of menopause and you have to go through it. No, you don't.
Wow.
You have to go through it,
Yes.
but there's ways to help you go through that. Maybe it's a better way of saying that. So I want to try to get back to these questions. My mind wanders a lot on these questions.
What do you want every woman to know? You were there, who's listening, about what their options are and how we work together to support them.
But I feel like that most women, we don't want you to give up. You feel that way for a reason. There are causes. You have to understand that you have to fight and claw and dig to get the answers to start to feel better. And that basically you're not alone. We don't want somebody to feel like that they are hopeless, that this is like, well, I'm never going to lose this weight, or I'm just going to, it's part of just getting osteoporosis, is getting older. And that is not true. And we just really want people to understand that you need somebody to help you walk through this and navigate this complex system that's unfolding. And I think we do a pretty good job of that.
For women who are on the fence, maybe feeling unseen, skeptical, or unsure, what would you say to them? Maybe something similar. I don't know.
Yeah, it all kind of is very similar. I mean, it's the thing about it is that what I always suggest to people is to, even if you are going to search for a long time, maybe, hopefully not very long time, but you'll search for a provider, healthcare provider, male or female, that will listen to you and direct you and give you options and help you understand why and what you can do to improve that. But with trying to find that, it's a matter of trying to ask individuals to, in your similar circumstances. Maybe there's a community of women that has the similar situations, similar symptoms. We talked about this morning is the fact that, well, there are many women that have and feel, as well as men that have and feel these similar symptoms, and that you may feel alone, but you're not alone, because there are other individuals that have the same problems. And maybe you can find out, well, where did you go? Who did you talk to? Or what have you done to try to resolve this? What worked for you? Or what have you done, type of deal. So I feel like that if people can actually communicate with each other better, then they'll actually find out that, yeah, I'm not alone. And there's things that can be done to this. It's not just taking this prescription and being happy, or taking this metformin, for my type 2 diabetes, or et cetera. So there's things that can be done. So I think I would encourage folks to not give up and to keep trying to ask around. And typically you'll find a population or a community of people that are going through the same thing, whether it be on social media or wherever. So.
Yeah, I think it's been really good to hear a lot of conversation recently about menopause and perimenopause. And we are definitely talking about things now that we haven't talked about,
Right.
Didn't talk about for a long time, and kind of opening up that conversation to ask the questions of, our friends and community. And I think it is important too to just mention that as you're having those conversations and you're hearing, oh, well, this is what I did and this worked for me, you do have to take that into consideration when you start doing things for yourself. Because one thing that I feel like I have learned in this work is that this is not this worked for this person, so it's going to work for everyone. And that's one of the big differences, I think, that we in our practice is that
It's not
it
cookie cutter.
isn't cookie cutter. It takes time. It takes time to get the exact recipe together,
Right.
but
Right. And,
it is achievable.
and to assume that you can show up and get a prescription for whatever it is, whether it be, estrogen or, whatever supplement or something like that, and not assume that's going to have to be modified or changed. I mean, that's just not reality. It's certainly something that there's individuals that don't respond to the same hormone replacement therapy, and maybe they have side effects with that. Well, that can't happen. We can't do it that way. And there's different ways of administering that too. So it's not just a cream or a patch or a pill. So there's other options for that. So, or a pellet.
So I do have a question that I just thought of, and that is, how do you feel when women have questions for you
Oh, I
or
love that.
question your...
Oh, I love that. That means they're engaged. That means a person truly wants to get better. They're curious, they have an interest, and they're engaged in trying to improve their own health. And this is a learning process for everyone, not just the patient, but also for us, because, we learn a lot from the patients by their questions or their problems or the way their labs come back abnormally.
or their experience.
It's true, right? So that all plays into it. And it's a very delicate dance, and it's truly navigating health. It's not just a take this and if it doesn't work, sorry type of thing. It doesn't work like that. So that's a good question. So what do you think that, women that are listening, well, they need to know about their options? Is it how does working together support her and what we can offer them?
Yeah, I think that there really are so many options, and you have to take it little bites at a time because it can be so overwhelming. And it's something that it's kind of a struggle, honestly, to take bite sizes because there is so much information
Right.
and education.
Like drinking from a fire hose.
Exactly. And so we will listen to the patient and move as quickly or as slowly as feels comfortable to them. And I think changing your perspective from thinking you're coming to a provider and they're going to be very prescriptive in the fact of you do this and this, it's a question and answer. We're going to find out what's going to work for you,
Right.
not we're not just going to give you the same spiel, although we do give similar spiels often.
Yeah. Yeah.
But everyone is so truly different, and there really are so many options. So come open to learning and really getting in touch with your body and your own intuition about what's going on with your health.
Yeah. Because we interview people and we can tell by talking to them that they're stressed. When you ask them, do you feel stressed? No. Yeah, you are. But you just they don't feel it. They don't see it because they've lived it for so long. But I always give the analogy too that their health is like a bicycle tire with many spokes. And all these spokes are different facets of their life that allow that wheel to spin smoothly. And when some of those spokes are missing or gone or too long or too short, it changes the way the rotation of the tire. And so, whether it's, stress, sleep, nutrition, exercise, supplements, hormone imbalances, it's just unending. Gut health, it goes on and on. So, but we always try to not force everything. All those spokes can't be fixed at the same time.
Yes, exactly.
And so, like you say, we kind of have to take little bits and pieces at a time.
Well, I think that's great. I think that really kind of helps our audience hear
Yeah.
what's your take. And
But yeah, I just, I would love to sum these things up in just a few words, but it's, you just have to not give up. It's something that you truly have justified feelings. You have justified symptoms, and there's a way to improve that. Not everybody's the same, and you may not get a resolution, but you can certainly tell that there are options out there for you and multiple ways of achieving, health. So.
excellent. Well, thanks for joining us today. And if you have any questions or want to reach out, please do so. And we'll look forward to talking to you next time. Have a healthy day.